Hello everyone. Myself Dr. Jitender Singh, MD, consultant diabetologist practicing at Care Specialty Clinic, Dwarka. So today I'm going to talk about the latest development in hypertension. So for that, first we are going to know what is the current situation of hypertension in India. So as per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27 are attributed to cardiovascular diseases, which affects almost 45% of the people in the age group of 40 to 69 years. Raised blood pressure is among the most important risks for CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension in general population, lack of appropriate care through primary care and follow-up. So in India, the prevalence has also gone up over last 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, or 51% of men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of men and more than 53% of the women living with hypertension did not get any treatment. Medications was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide, according to Lancet reports. International Society of Hypertension has released the 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in poor resource settings. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standard of care to allow specification of essential standards of care for low resource settings. The AHA and ACC has released a scientific statement in 2021 offering a new guidance for the management of stage 1 hypertension among patients with low ASCVD risk. Among low risk adults, that is no ASCVD or 10-year CVD risk less than 10%. With stage 1 hypertension, that is systolic blood pressure between 130 to 139 mmHg and diastolic blood pressure between 80 to 89 mmHg. The management starts with non-pharmacological therapy, that is lifestyle modification. But if the blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacological therapy. Acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts often associate it with severe COVID-19 infection in this COVID-19 pandemic era. A recent study, which appears in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19-induced ARDS. Again, lowering systolic blood pressure targets down to 110 to less than 130 mmHg range substantially reduce severe adverse events in the STEP randomized trial, affirming the sprint findings for an older Chinese population. Among some 8,500 patients ages between 60 to 80 in China, the intensive targets trimmed 26% of the composite CV risk. Findings from now a second major trial supporting a lower target could unite the guidelines, which even among US professional societies ranges from threshold of 130 to 150 mmHg. With regards to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on office BP measurement, but also an out-of-office measurement such as home blood pressure monitoring. 24-hour and nighttime BP measurement were associated with greater risk of mortality and a composite of CV outcome. Thus, they may be considered as the most relevant measurements for estimating the CV risk. For every 10 to 20 mmHg increment of BP measured at night, the risk of mortality increases by 23% and the risk of cardiovascular events by 36%, which is a huge number. Most of the patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs, considering High non-adherence treatment and the importance of combination treatment is particularly highlighted to improve the adherence to the therapy. Therefore, the 2018 European guidelines recommend, especially in the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed combination of ACE inhibitors, ARBs plus calcium channel blockers, or even diuretics. Since early July 2018, products containing valsartans have recorded worldwide. The main reason behind this is a detection of known carcinogen, namely NDMA, which can be found in candesartan, losartan, olbisartan, and valsartan. NDMA has been classified by the WHO, International Agency for Research on Cancer, to be carcinogenic in humans. If 1 lakh patients would have received NDMA contaminated valsartan manufactured from Zhejiang, Huai, where the highest level of contaminants were found every day for 6 years in the highest dose, it could result in 22% additional liver cancers over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they have taken the highest daily dose over 4 years. Valsartan recall accompanied by a significant increase in the rate of emergency department visits by almost 10%. The highest study represents that the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with significant reduction in endpoints, which includes death also. The higher chronotherapy trial tested whether nighttime therapy, in comparison to usual upon awakening hypertension therapy, exert a favorable CV risk reduction. The largest study included a total of 19,084 hypertensive patients during an average follow-up of almost 6.3 years. They have found that 1,752 participants experienced the primary CV outcome. An ambulatory BP measurement was performed for 48 hours to collect the data on how BP differed during sleep and during awake positions. The risk reduction for CV events was significantly improved for nighttime treatment when compared with awakening treatment. Thank you.